Well, hi everyone. It's Dr. Scott Stoll here with the amazing Dr. Gemma Newman. She just finished recording her presentation for the International Plant-Based Nutrition Healthcare Conference. Gemma, we're so delighted that you're joining us this year, and you didn't have to fly across the big pond. Thankfully, technology allowed you to present from UK.
Yes,
So we're really
it's
grateful.
great. Oh no, I'm absolutely honoured to be here. And as much as I would have loved to have been with you in person, I am so honoured to at least spend some time with you all virtually. And yeah, I feel great to have just been able to deliver a talk, which I hope you'll all really enjoy.
Yeah, why don't you take 30 seconds to a minute and tell us about your talk?
So I don't want you to miss this one. It's really important. It's about how to help your patients implement lifestyle change in a short space of time. I found in my clinical career, which spans 17 years, that you can't make people change. They have to want to change. And sometimes it's hard to remember some of the techniques that you learned in medical school, those consultation skill techniques. They can fly out the window on a stressful day, on a busy day. And so I've come up with a unique framework that will help you to remember how to implement change with your patients and how to keep them motivated.
That is brilliant. Wow, beautifully said. And that's the essence of what we do. We can talk all day long about the molecular biology of plant-based nutrition, but at the end of the day, it's getting our patients to make a change. And that's why I love what you're doing. And I love this talk that you put together. And
Thank you.
I just also want to highlight, you have an amazing book called The Plant Powered Doctor, A Simple Prescription for a Healthier You. And anybody that's watching, if you've not picked up that book, I want to encourage you to go out and buy the book. It is fantastic.
Oh, thank you,
So
Scott.
thank you, Gemma, for writing that.
Oh no, it's my
Yeah,
pleasure. It was a great process to do it. I really wanted to create something that would be a one-stop shop for people, so that they could get the science, they could get the personal stories, and then they could get the how-to. There's 60 delicious recipes in there as well. There's diseases from heart disease to diabetes to skin health to hormone health to plant-based for all ages. So it's a book hopefully that will, keep on giving over the years.
yeah, and you really have boiled down the behavior change piece of that too. And that's what I really appreciate. And that's why I thought your book was so excellent.
Oh, thank you so much. Well, that was the aim, and I think that's really the aim of the talk today for healthcare professionals, as I mentioned, because it can be so demoralizing when you know the science and you just want people to be able to go away and improve their lives, but there are some big psychological barriers there. So more confident.
That is fantastic. Well, thank you, Gemma. And as we wrap up here, maybe you can give our colleagues like one clinical pearl, something that you've learned that really changed your life in clinical practice.
Well, I have to say, probably the biggest piece of advice that I've been given in my clinical career was to leave my ego out of the consultation room and let go of the
Mhm.
outcome. And that doesn't mean that you don't care about your patients. It just means that you give them the very real autonomy to make a change for themselves. And that's probably been one of my biggest learning points over the years.
Yeah, that's fantastic. That's exactly right, because we're trying to empower our patients, not transfer our knowledge to them. And so that's beautiful. That's where it starts,
That's
humility.
where it starts. Exactly. That's where the healing begins. And I think we it's important for us to know the information so that we can feel confident to share it. But it's also important to learn from the person sitting in front of us and what they need in that moment to help them to take that next step. So yeah.
That's right. It's really honoring our patients and their individuality and the power of choice that they've been given.
Yeah, that's the idea. And I think a lot of the time, the way that the world works is that their choices have been taken away from them. The foods that are presented to them, the environments that they're in. So I think the whole theme of the conference, as well as medical learning and medical education, is about empowerment. So yeah, it brings me so much excitement to know that there are all these people coming together to learn about this stuff and hopefully take it away and change lives with it, because that's what we all want to do at the end of the day.
Yes, and with talented physicians like yourself in the UK and many others around the world, that's why I think we all have hope that there is change. We've seen such change in the last decade and even over the last 3 years. with leadership like yours, in the UK, that's bringing change not only to our local practices and our communities, but also to the globe. So Gemma, thank you so much for taking a few more minutes of your evening to be with us. I wish you and your family all the best. And for all of you that were watching, please, if you've not signed up yet for the International Plant-Based Nutrition Healthcare Conference, you can do so at the website www.pbnhc.com. And conference starts September 24th through the 27th. So you have a little time left. You do not want to miss out on incredible lectures, like a lecture from Dr. Gemma Newman. So
You
Gemma, thank
definitely don't
you
want to miss
so
this,
much.
so sign up.
That's right. You're right. Thanks,
Okay,
Gemma.
thanks.
Blessings to you and your family. Thank you.
Thank you. Bye-bye.